Hi, my name is Levi Moore, and I'm the Foxglove Alliance Coordinator for the Hectone Institute of Medicine.
And my name is Meghan Phillipp. I serve as the Executive Director of HC3, the Healthcare Council of Chicago, which is managed by Third Horizon Strategies. Today we are here as our co-hosts. We are not normally together, but throughout the year have been rotating hosts on our show, Community Pulse. So Community Pulse is presented in partnership with Foxglove Alliance, as well as the Hectone Nurses and the Humanities and HC3. We focus on a variety of health and wellness and public health issues, and we're here today to talk about kind of what we have covered this year.
We're going to try to get through the confusing part first. Okay. This show is sponsored by the Hectone Institute of Medicine, an 80-year-old institution in Chicago dedicated to public health. Hectone is the sole financial sponsor of the Foxglove Alliance, a coalition of 15 public health care organizations in Chicago. This show, as Meghan said, is a partnership. It's a Foxglove project, Hectone project, HC3 project. So, and our other partner who is not here, the other co-host, Takora Love, is actually the head of a program called Hectone's Nurses and the Humanities Program. And also, that program is also the Illinois chapter of the American Society of Surgical Nurses. So they're sort of dedicated to arts and culture and humanities, but also to the development of people in the field of surgical nursing. So that is how this all works. And Foxglove is a member of HC3, and HC3 is a member of Foxglove, and we're at meetings together all the time.
In Chicago, we collaborate.
Yeah.
So we wanted to talk through today some of the various folks that we got to speak to and reflect on some trends this year. Unfortunately, Takora is not able to join us to share, but she did get to talk to several great folks from the Kindness Campaign, the founder of Nurses and Humanities, Mary McDermott, as well as Carolyn Smelter and other great folks. And I had the pleasure of interviewing folks from ICANN, the Illinois Contraceptive Access Now, folks from Planned Parenthood of Illinois, as well as Community Health, Howard Brown, the West Side Task Force for Recovery Month, and then most recently Honeysuckle Homes, who just opened their doors recently. So lots of different folks. And Levi, who else did you get to talk to this year?
Okay, well, first let me make a point, because I don't want Takora to get mad at me, but I promised. Please go to kindnesseveryday.org and look at events, because apparently there are going to be a lot of events during the holiday season. Now, as for me, I got to lead off. I got to host the very first Community Pulse show in January with Aisha Jaco, the Executive Director of Westside United. And if you don't know about Westside United, learn about it. It's one of the most dynamic, most effective community revitalization, community development organizations, not only in Chicago, but in the nation. And so outstanding that they're actually part of a study by the London School of Economics. Also, we had a briefing on what happened in Springfield after the budget session ended from State Rep Will Gazzardi. Two of my partners that were part of the iDrop Coalition, Illinois Drug Reuse Opportunity Program. Garth Reynolds, who was the Executive Director of the Illinois Pharmacists Association, and Elizabeth Lindquist, one of the co-founders of iDrop. We kind of gave an update on that. Shelley Mitchell with Versity Blood Centers, where we talked about two really important topics. We talked about sickle cell anemia, and please listen, we talked about the donation of blood. Especially in our minority communities, there is a huge need for more blood donations. And this was even before we go into the holiday system season where, there's a huge need for blood. So if you can, please do. And then finally, I'm Melissa McGuire, the head of the Illinois Association of Free and Charitable Clinics. So, those were that was our first year at it. The goal is that we do 2 shows a month. We missed that by a little bit, but now we're cooking and rolling, and so look for 24 shows from us in 2024.
Yeah, with more great folks. And if you're interested, please feel free to reach out to Levi at Foxglove Alliance or myself at HC3 or Takora at Nurses in the Humanities. I think that when we decided to collaborate on this, each of us are focused on various different things within healthcare and what that means for Chicago. So I think we all brought quite a diverse set of stakeholders. To your point, West Side United is focused on economic development. A lot of the things that I focused on were a little bit more healthcare delivery. And so I think that there's just a tremendous amount of support and great things happening, and we're really grateful for the opportunity to highlight it here on CAN TV.
Yeah, and one thing about the 3 of us is that, we are not medical professionals. We network, we collaborate, but now Takora really is a medical professional. So she could bring a level of expertise that we don't have. So we think our little trio works really well. So now we got that out of the way. Now, let's talk about just some of the biggest stories in healthcare, public health in Chicago this year. And there were a lot. Want to get the ball rolling with Medicaid redetermination?
Medicaid redetermination, or the unwinding of it.
Yeah.
What a topic. I feel like we could spend all of the rest of the time talking about this. I think the headline is that, in the post-COVID world, what we're seeing is that people were on Medicaid, which is a government program that supports people with their insurance. It basically, kept people on each year during the pandemic, but that was unraveled this year, and so that deadline passed, and so now people have to re-up their eligibility, and unfortunately, the process of doing that is not as easy or well managed as we would have liked. I feel like I want to put credit where credit is due. The offices at the state, several of the Medicaid managed care organizations, and many community organizations have done a tremendous job of getting their feet to the street, getting on those phones, and really doing outreach to meet these people where they are. But I think the biggest challenge is like, you may have gotten a very nondescript envelope in the mail to let you know that this was happening, so it could have gotten thrown out, or you could have moved. And so there are a lot of reasons why people didn't even know that they might be rolling off because they weren't well informed. So, the logistics is one part of it, and then the other part is really just where we are in, our economy, our ecosystem, and I think that what we're seeing is now the numbers are coming through in the last couple of months. In early August, it was in the a number that you just are devastated by, to know that these people are now uninsured. And what does that mean? It means that now when someone gets sick and they go to the hospital, they're going in there and coming out with bills, or the hospital is absorbing that. And so it's going to be a huge problem for us if we don't continue to monitor it and sort of re-up. And right now it's open enrollment through the end of the year, so I encourage you, if you can, through your employer or otherwise. But Levi, you tell me what your thoughts are besides my logistical nightmare of observing.
Well, there were some mistakes in classification, because there were some people that were knocked off that really should have just simply been automatically renewed. But I'm going to give you a couple of tips that I've learned from some of the people on this show. Okay, contact whoever your previous healthcare provider was when you were under Medicaid if you're off. 2, there's a group the Illinois Association of Free and Charitable Clinics. If you go to their website, they're a .org, and I don't remember the exact, I think it's illinoisfreeclinics.org. Identify a clinic that might be near you, and you can get assistance in determining, if you can get back on. Finally, and here is a really, if you don't listen to a word I say the rest of this show, this is a good one. Go to your pharmacist. The Illinois Pharmacists Association, one of their big priorities was making sure that people got to stay on Medicaid if they were on it during the pandemic. So pretty much all pharmacists are well versed in like where you can be directed. And they found out, it was really kind of funny because this was when the vaccine started to really roll out, and I didn't realize this, was that instead of like trying to go through healthcare systems, people may visit their doctor once or twice a year. A lot of people will visit their pharmacist once a month. And the pharmacists were way better at being able to connect with people than almost anybody else within the healthcare system. So yeah, those were some tips from me because there are a lot of people that should still be on who are off. And we'll get to this next year, but then Illinois is doing something that could actually make this go away. Next topic, like in everything, we have a shortage of healthcare workers, and it's severe too. Just like, okay, in Chicago, we don't have enough L drivers, we don't have enough hotel workers, we don't have enough police, we don't have enough firemen. That goes also to clinicians, technicians in health systems, community healthcare workers, and it's, it was just demographics. We're going to be in this situation between now and about another next 7 years where, it's my favorite numbers, every day in the United States, 10,000 people are turning 60 years old. This is the aging of the baby boomers. They are retiring. And then during the pandemic, a lot of people realized that, you know what, I'm done. I'm close to retirement. We're going to retire. But we don't have enough people who are in their 20s or their teens, especially in their teens, ready to fill that void. So,
yeah, I mean, the workforce challenges, as Levi outlined, is industry agnostic. We are especially seeing some challenges in the healthcare and human services world. And the way that I look at it is we were starting to see this trend prior to the pandemic, and the pandemic exacerbated this issue. To Levi's point, there are a lot of people retiring, but there's a lot of burnout as well. And so there's a movement to be more supportive to the healthcare workforce, to all of our workforce, I think. I'm very proud of the work that's going on at the Corporate Coalition of Chicago and their efforts to really think about the corporate America role in creating space and place that is supportive of a sustainable workforce, but also just to observe, we also are developing opportunities through partnerships like the Chicagoland Healthcare Workforce Collaborative and the Public Health Workforce Collaborative, which are convening to understand and solve for where is the pipeline. To Levi's point, we are not seeing young folks be interested and wanting to be in healthcare careers, even though they are and can be very fruitful and hopeful. But we also want to make sure that people are exposed to the opportunities that they may not realize are there for them. So it's complex. It's not going to be solved overnight, but I'm very grateful and hopeful for some of those partners that I mentioned and several others that I think are doing some really creative things to think about what is our next generation of healthcare workers, as well as scientists and other aspects of what goes into creating healthier communities. But in the immediate future, it is going to be a challenge, and we're going to have to get creative with where we can support the providers that are in the field. One other thing I will add, and it's a great segue into our next topic, is the shortage around mental health workers especially is going to be challenging as we look to examples like, the city of Chicago trying to reopen centers because we are experiencing a mental health crisis across the board nationally and across Chicago. All of us have collectively experienced a trauma during the pandemic, and so there is a lot of challenges to people. But in order to support and service those people, we're going to need people in place. And it's very complicated because I would say there are some legislators and some advocates that will say that we do not pay those people enough, and there are not enough incentives in place for us to get those people into those jobs. So we can open these clinics, we can create more spaces, but we are definitely concerned about how we staff them.
Yeah, it's, the two are connected, and you can't just snap your fingers and create more people. We don't have enough people in their teens and 20s, but how do you move them quickly into positions where they can provide direct assistance? Now, to give an example, Westside United, Fox Glove member, they were formed by the hospitals that are in the west side of Chicago. They have programs where they are trying to get youth in the community to expose them directly into, okay, this is what you have to do to be a nurse. This is what you have to do to be a technician or whatever. And I'll tell you something too, that they're doing it in a way that's a little bit different now. It's not just go into this short-term job. They're actually looking down the road, say, okay, this could be your career path. They're coming up with different, not just Western, but they're coming up with different programs where, okay, young person, we will put you in a training program where you'll be able to generate revenue, income, but then by going through sort of a boot camp, where within a few weeks, you'll be earning a salary. And then here is the path as to how you can turn this into a long-term career. And a lot of this with, home with community health workers, nurses, but then there are other paths too. And something I didn't realize, that a lot of the jobs do not require four-year degrees. They're associate's degrees, a couple of certifications. So if you're a 17-year-old or the parent or the grandparent of a 17 or 18-year-old, be mindful, be on the lookout, because there are a lot of opportunities available to fill this void. And they're looking for people. And it's not just, being a nurse. It's not just, being a doctor. There are all types of positions that can be filled, that need to be filled.
And the mental health of these workers is critical, and that was our kind of next topic, is the mental health crisis that we're seeing across the board. We have seen definitely an influx of interest, and this isn't something that I think was new just because of the pandemic. I think there is definitely a lot of stigma and breaking down of issues that people are starting to realize that mental health, when treated, can be just as effective as treating physical health. So what does that look like? It can be complex for some people, where medication and alternative medicines are supportive of that. And it can be as simple as making sure people have social resources, whether that's therapy or other mechanisms. I think there are a tremendous amount of things being done to create these opportunities. We are especially seeing a great amount of effort for coordination, especially for children's behavioral health. The Illinois State Director has put together a collective of all the state agencies to be more coordinated and to be more effective when we're talking about kids that are in transitional care and that need those extra supports. So it's incredible to see, especially as we're looking to our youth. But this isn't, age agnostic. We also know that loneliness is a very critical piece, and that there are challenges to our older populations, and some of our providers are being very thoughtful about how they're addressing wraparound supports. And then the additional piece to this, and unfortunately what we've seen because of the pandemic and what we explored when I interviewed the West Side Opioid Task Force, is that one of the highest rates of death is still opioids and drugs. And so we have a lot to do in breaking down those stigmas and barriers and finding more solutions and ways to support people to find their paths, so that we're not losing our friends and our neighbors to such a deadly disease, which is definitely fueled by determinants that are sometimes not just addiction. So,
and I want to wait. And it's kind of weird because I'm not from a big city like Chicago. I'm from East St. Louis, a much smaller town. And back home, we know, check on Mrs. Brown. So-and-so hasn't been to church in a couple of days. Don't expect a program or part of the government or whatever to be the first entity to notice that someone that you interact with or that you're related to may have some mental health issues. Odds are the neighbor will be the first person, or the people you go to church with, or the people you're in an organization with. So if you see one that may be having a problem, take it upon yourself to try to help.
And there's a brand new hotline, 988, which can connect you to resources, especially for suicide. They're operated by C4 and NAMI Chicago here in Chicago, so they can definitely help in an ad hoc basis to address your specific needs if you need help, or to help a friend or neighbor, or a situation that's happening. So you don't have to call 911 if someone is having an issue. So that's a really, really exciting thing that's happening across our nation, but I think we've seen a great deal of support being shown through that resource in our local market. We are going to wrap up fairly soon, but we're going to have a part 2 of kind of more topics and issues. But I just want to say, thank you to all of the amazing people that we have brought along this ride on this year's show. This was a new venture for us, but it's been an incredible partnership. And I have to blame this guy for inviting me to join this, so thank you. I truly believe one of the things that I firmly stand upon is that partnership is how we're going to solve some of these healthcare problems. So I'm grateful for the opportunity to elevate them here. Levi, you have anything else you want to add?
Yeah. Well, this is part 1 of our end of the year wrap up. You're going to see we're going to be wearing the same clothes when we do the next show. But here's what we're going to start talking about. 2 issues that are really kind of combined. The end of the federal money and the impact it's having on healthcare in Chicago, and how we're dealing with the migrants and asylum seekers in Chicago. So that's going to be our next show, and be on the lookout for it. And just wanted to thank Rose here and the Not-for-Profit Services crew at CAN TV, and look for us.
Stream us online or check us out on Channel 21. And thank you again. This has been Community Pulse.
Yeah.